Hi, you must be John. My name is Danielle, and I'm a nurse practitioner. I'm sorry that your injury has happened today and brought you to the emergency department. Your coworkers, however, acted fast and put pressure on the wound, which is very important in an injury like this. Can you tell me about your medical history and explain the incident and what happened today? I read over your lab values, and you were experiencing posthemorrhagic anemia due to excessive blood loss from your injury. In simple terms, you lost a lot of blood. I'm unsure what your normal hemoglobin level is, but today your hemoglobin level was 8.5. Low levels for men are considered to be below 13.5. The symptoms you're experiencing are due to that level being low, which caused your heart rate to be elevated and your blood pressure to be low. Signs and symptoms of acute posthemorrhagic anemia can include feeling weak and lightheaded, as well as having a fast heart rate, clammy skin, shortness of breath, decreased urine output, confusion, headache, chest pain, and even seizures. For this reason, we gave you a blood transfusion and fluids through your IV. Your hemoglobin level will be checked after your blood transfusion is complete. With this type of traumatic injury, it is important to ensure that there is no other internal bleeding going on. With an injury like this, it's important to ensure that there's no other bleeding, such as bleeding in the abdomen and pelvis. This type of anemia is not chronic or due to any other type of genetic conditions, assuming that you have no other underlying medical conditions and are otherwise healthy. You are expected to make a full recovery after this injury, although due to the severity of the injury, close follow-up is very important. However, we would also need to perform an X-ray on the right leg that was injured to ensure that there is no debris present or broken bones. I would like you to begin eating healthy foods that are high in iron and vitamin C. This includes nuts, meats, dark leafy green vegetables, and beans. These foods are high in protein and iron, which will facilitate your recovery. The vitamin C increase is to help the iron absorb in your body. Foods high in vitamin C include oranges and other citrus fruits. You should also be increasing your water intake in order to stay hydrated and avoid dehydration. With this injury and the excessive amount of blood loss, it is possible that you would need to be admitted to the hospital to monitor your blood levels, as well as monitor any other organ damage from the low blood volume. You may not need to be admitted to the hospital and are discharged, but close follow-up is important to monitor your hemoglobins to make sure they are recovering properly and to make sure that you have no organ damage. You may also need to be on crutches and be non-weight-bearing with your right leg to allow proper recovery of the leg and the stitches that were performed today. Do you have any questions regarding your recovery or anything that we went over today?